Good morning, good afternoon, good evening, everyone. Thank you for joining us today. We're going to get started in just a couple of minutes. We're letting a few more people join in, so please hang tight. Thanks. Okay, hello everyone. Thank you for joining us today for our learning event on the simplified approaches for the early detection and treatment of child wasting. We're very excited for all of you to join us today. Good morning, good afternoon, good evening. We have quite a big group joining us and we're very, very excited to have all of you. We will go ahead and get started. I think more people will join over the next few minutes, but let's go ahead and get started. Once again, thank you for joining us. My name is 𝗁𝗶𝗺𝗲𝗃. I'm a nutrition specialist with UNICEF, specifically working on the team that focuses on wasting, and I focus on the simplified approaches. Next slide, please. We want to get started just by going over the objectives. Why are we gathered here this week? Why have we put this learning event together? The objective is to really support the implementation of the simplified approaches by building capacity and introducing tools and resources on how do we go about implementing the simplified approaches. We've all heard a lot about these simplified approaches. And this week, we really want to focus on the how, explaining the black box. What does it look like when we're on the ground and ready to implement these different modifications? Next slide, please. Just a few quick housekeeping points we want to go over. Please do tune in to the translations that are available in French and Spanish. You just select that channel when you join, and translation will be available throughout the course of the week, including during the Q&A and roundtable. Speaking of Q&A and roundtable, at the bottom of your screen, you will see there's a chat box where we are encouraging you to please introduce yourself when you join, but there's also a Q&A box. If you have questions, please do direct them into the Q&A box, where we will be monitoring over the course of the sessions and ensuring that your questions get answered. Lastly, we do want to make this as interactive as possible within this webinar setting. So over the course of the different sessions, we will be having questions that will be posed to you via polls that you can answer directly on your screen. So do keep an eye out for those. That's a really great way to participate and interact during the course of the sessions this week. Next slide, please. So this event is hosted by UNICEF and the Global Simplified Approaches Working Group that includes quite a number of partners, many that you will hear presenting their work this week. So a big thanks to this group that helped us put this event together and in the planning and preparations for the week. Next slide, please. Quickly, I just want to go over this morning's session. We have quite a packed agenda, so we will try to stay on time so that we can get through it all. I'm going through the welcome now, and I'll pass it over to 𝗹𝗶𝗺𝗲𝗃, who will sort of set the stage in terms of the simplified approaches where we are. Then we'll hand it over to 𝘁𝗶𝗺𝗲𝗏, who will provide a quick update on the WHO guidance. We will then have an exciting panel moderated by Erin Boyd from BHA in discussion with a couple of our donor colleagues that are here. And then we will move into reviewing some of the tools and resources that are available, and then talking about where we are in terms of the implementation of the simplified approaches from a regional perspective. We'll hear both from our colleagues in East Africa and colleagues in West Africa. And then lastly, we will have a roundtable with all the panelists where we will have an opportunity to ask any questions that you haven't been able to get through yet, or that you would like to ask during that session. And then we will have some concluding remarks towards the end of the session. Next slide, please. So in order to define the simplified approaches and ensure that everyone who's on has a clear basic understanding of what we're talking about when we mean simplified approaches, we want to play a very short video. So please enjoy. Thank you, Milish.
Children suffering from wasting are up to 11 times more likely to die than well-nourished children. This makes wasting one of the most significant contributors to child mortality. And yet, current treatment services reach only 1/3 of the children in need. These services must become more accessible and easier to implement, which is where simplified approaches come in. Simplified approaches aim to increase the availability of a more efficient and effective model for the early detection and treatment of wasting in facilities and communities. Simplified approaches vary by context. There is no singular protocol, rather a series of modifications. Here are 7 of the most common modifications. Training caregivers to monitor their children at home frequently, using MUAC tapes so wasting is detected early. Moving treatment services closer to home by engaging community-based workers to deliver treatment. Using simpler tools to admit children for treatment, like MUAC or edema screening. Expanding cutoffs to include more high-risk children for treatment. Shifting from multiple treatment products to one treatment product for all wasted children in need. Simplifying and optimizing the dosage of RUTF to reduce costs and make services easier to implement. Reducing the frequency of appointments during treatment to ease issues regarding access. No matter the context, strong monitoring mechanisms must be established to ensure quality standards are met. There is a lot of noise and talk out there. The best place to find useful information is the Simplified Approaches Toolkit, specifically the Starter Pack, which has a series of evidence summaries and quick guidance notes. You'll find the toolkit along with other resources and guidance at simplifiedapproaches.org.
Wonderful. Well, thank you again, everyone, for joining. So we'll go ahead and get started now that we all hopefully have a basic understanding of the different modifications, which we'll be diving into over the course of the week. So now I would like to hand it over to 𝗹𝗶𝗺𝗲𝗏, the nutrition advisor at UNICEF, who will sort of set the stage and talk about a bit further about where we are on these simplified approaches today. Over to you, 𝗹.
Hi, Grace, and thanks everybody for being here. As Grace says, good morning, good afternoon, and good evening to the 194 people who are joining us on this call today. It's very exciting to see such a high number of people from around the world join this conversation on simplified approaches, which up until not so long ago, it felt like a conversation that was happening here and there in different countries with different teams, but it's rapidly become, I think, especially over the last year, into a really coherent and coordinated agenda, thanks to the work of the Simplified Approaches Working Group and many of the people on this call. So what I want to do to set the stage is just really try to highlight a couple of really important things and answers to 2 really important questions. One is why? Right? Why are simplified approaches an important part of the wasting agenda today? But also how, right? How did we get here, and what has the last few years been like that's sort of set the stage for this conversation today. Next. So I think that the fundamental answer to the question of why does all of this matter, has everything to do with the sort of hidden potential of these simplified approaches. Over the last almost 20 years now, we have seen a rapid acceleration in the implementation of community-based management of acute malnutrition around the world. I believe that somewhere around 70 countries today are doing some form of CMAM out there. But we continue to operate in a resource-limited setting and face a demand for services that is just simply greater than our capacity to meet that demand. So Simplified Approaches really is an opportunity to bring together a lot of the ideas and the solutions that can help us bridge some of these divides and these challenges. But in particular, I would say that in the context of limited resources and as I said, this increasing needs, these approaches provide just the potential to reach more children in an effective, equitable, and acceptable way. So it really continues to optimize the way that we provide detection and treatment services. The truth is, though, that the push towards simplification responds to a question of the need to improve cost effectiveness, but it also responds to the shift that we have also seen, and I would say maybe probably since about 2007 onwards, to integrate these services into health systems. You know, the more I think that the more we have worked with national health systems to integrate detection and treatment of child wasting, the more we have realized that there are elements about the original CMAM model that simply won't travel into a health system, and therefore we need to find opportunities to make the approach to detect and treat much simpler to make part of national health systems. So that's a really, really important part of it, in particular in the context of decentralizing care in a way that achieves greater coverage. So really, it's a question not just of making it more cost effective, but also making it more feasible to integrate and deliver as part of primary health care. But really, it's about, at the heart of it is a trying to find a way of mobilizing a range of opportunities that are being identified in a number of different settings and bring it all of that together into a coherent process that can help us answer that question of how could we do better, right? How could we do better when we constantly face this challenge or that challenge? So the opportunity that we have over the course of this amazing event this week is to really hear about the range of things that are happening and really be able to separate a little bit the things that seem to be really ready to go and the things where we're starting to get the evidence that we need to move forward, but where additional evidence is still needed. So the question, of course, is how do we get here, right? And what has been the road behind us that got us into this particular conversation? Next. So the process that got us to this very week, it's a process that began long ago, arguably, about a decade ago. And it really began with the simultaneous launch of a number of sort of initial research trials that has really since set the stage for the Simplified Approaches agenda. Of course, there's the 𝗿𝗶𝗺 project and the work of the IRC and Action Against Hunger on that, of course, is duly noted. I mean, that really triggered a lot of the fundamental conversations that we're having today. But then we also had the 𝗿𝗶𝗺 project, as well as a series of trials around the use of family MUAC. And really that period between 2012 and 2017 showed that sort of gradual launch of a number of important initiatives. Now, around 2017 and that period until 2019 or so, we really began to strengthen the process to try to take stock of who was doing what and where, right? So we started having inter-UN agency meetings. We met in Geneva. We talked a little bit about the state of the evidence. Then we started having more and more regional and national level coordination discussions that also helped come up with common definitions of what we were trying to do. But what really accelerated this conversation was COVID. because a lot of the things that we had been talking about pre-2020 about doing at a programmatic level, whether it was simplifying, whether it was reduce visits to OTPs, whether it was just decentralizing further through community health workers, all really became essential during COVID, right? Because COVID then suddenly introduced all these challenges that essentially facilitated or acted as a catalyst for the large scale uptake of a lot of these simplified approaches. And in doing so, it also forced us to have stronger global coordination mechanisms and stronger global interim guidance, which of course is where the Simplified Approaches Working Group has really come into its own. And then really for what has been a very heavy year on child wasting, there's been a series of things that have been really important. One of them was the launch or the development and launch of the Global Action Plan on Child Wasting. And that really started to create a framework for action at a global level that also incentivize or at least raise the conversations or the questions around simplified approaches in specific countries. So that process of the GAP really accelerated and pushed a lot of the simplified approaches agenda forward. And certainly from our side at UNICEF, an important moment this year that has also, again, set the stage or strengthened the platform from which we're doing all of this was the release of the No Time to Waste plan, which for UNICEF really clearly lays out some of our expectations or hopes when it comes to simplified approaches over the next few years, but also some concrete commitments of what we want to do. And that really brings us to the question of moving forward. And I think that there's a couple of really important things that this meeting sets the before and after of. The first is, the process that WHO is completing, and which 𝗁𝗲 will speak to in a minute, for normative guidance review. I think that process will really help crystallize a lot of the conversations that we have been having. But I think that there are other issues that perhaps are not so dependent on normative guidance, like, for example, empowering women and other caregivers to do more MUAC in their homes, which are ready now. And I think we're going to see over the next year or two a large-scale program implementation, as well as broader efforts for multi-stakeholder capacity building initiatives. And then really, I think that what we expect to see coming out of this meeting will be a series of recommendations as well that will help inform how we start operationalizing and implementing a lot of things and moving forward. And as I said, in particular, how we sequence that process of enabling WHO to complete the normative guidance review, but at the same time start meeting governments where they're at. Because as I've said before, the reality is that the simplified approaches agenda is not a top-down agenda, is not an agenda that we are pushing into countries. The reality is that for the last 4 years or more, the simplified approaches agenda is a response agenda to the demands and questions and queries that we're getting directly from the governments already. So this is a unique opportunity to take stock of a lot of the things that have come before, to build on the success of the Simplified Approaches Working Group and a lot of the work that has been done in country, but really to start setting the stage for starting to firm this up in the normative guidance, but also to start seeing it rolled out at country level from next year onwards. So on that note, I want to close by handing over to my colleague 𝗁𝗲 at WHO, but not without saying that we're incredibly excited to be working on this. We're also really excited to be working together on this, UNICEF and WHO, because we recognize that we need to move both elements in tandem, and we couldn't have hoped for a better partner to do that with than 𝗁𝗲 and her team at WHO. So on that note, over to you, 𝗁𝗲, and thanks everybody.
Thanks, Saul, and thanks so much for inviting WHO. And as Saul said, it's kind of not a surprise we're here because we are really working together with UNICEF. So I don't have long, so let's just crack on. So I suppose I should introduce myself. I'm 𝗁𝗲. I'm a technical officer in the Department of Nutrition in WHO headquarters, where we have a lovely team, and we're working on one of our many things that we're working on is on to the normative guidance, the guidelines on the prevention and treatment of wasting. So next slide, please. So as of today, 13th of December, 2021, the current WHO position is still as per the 2019 communique, which was put out after the technical consultation that Saul was referring to with UNICEF, WFP, UNHCR, and WHO. And that was that simplified approaches can be considered in exceptional circumstances where appropriate and with monitoring. And so, but one of the next steps of that communique was all about reviewing the normative guidance that would be relating to some of the aspects of simplified approaches. As Sol also said, alongside that, though, WHO and UNICEF together came up with the implementation guidance about using simplified approaches in relation to COVID, really to try and reduce the risk of transmission of infection for patients, caregivers, and healthcare personnel, and really trying to minimize disruption of services. So, as I said, next steps in this communique, next steps for WHO in the whole world of simplified approaches was to look at the normative guidance. So we are in the midst of developing these guidelines on the prevention and treatment of wasting in infants and children. So we at WHO use PICO questions to come up with recommendations. And so sorry to all the people who may have tuned into the webinar on the updates of the wasting guidelines, because I'm about to repeat a few things. So we use PICO questions to come up with our recommendations. P is for population, who are we interested in? I is for intervention, what do we want to do? C, the comparator, what are we comparing it to? And then O for the outcome, what are we looking? So we have 16 quantitative PICO questions trying to come up with recommendations. But very importantly, we have 7 qualitative and 3 resource, and so 4 qualitative and 3 resource use PICO questions. And that's when we're trying to look at not just the quantitative evidence, but qualitative access. What's the acceptability of some of these interventions? What, of course, are the resource use and cost effectiveness? What's the equity of some of these interventions? So these are really important elements. And then we use the grade process where you take the quantitative evidence, but we also take in all these other aspects, and we make an evidence to decision-making table that helps the WHO guideline development group try and generate the most balanced and evidence-based recommendations that we can come up with. And we'll be having a series of meetings up until April where we'll be coming up with these recommendations. So we've got these 23 systematic reviews underway. That's a huge amount of reviews. We've already had quite a few of them coming in. Spoiler alert, it's never kind of a cut and dry, never a black and white. So we know there's going to be lots of really interesting discussions. Next slide, please. So digging down a little bit, let's look at what are the PICO questions related to the simplified approaches. Now you can kind of argue almost all of the PICO questions. There's some element that you can be relating to simplified approaches, but I just want to take 5 that I think are really direct, and then another 2 which are a bit more indirect. So in PICO number 1, we're going to be looking at essentially admission and discharge criteria. So that's really looking at what is the evidence that would trigger referral and admission into outpatient care, referral to inpatient care, referral back to outpatient care, and discharge. This is not just 𝗁𝗏 versus 𝗿𝗏. Okay, this is taking into account lots of other elements. It's taking into account how we look at risk for these children in terms of morbidity and mortality. So that, of course, does relate to when we're looking at programs, we are thinking of 𝗁𝗏 only, as we've seen in the simplified approaches. PICO number 7 is related to moderate wasting. Now, as we all know, children who have the anthropometric measurements that put them in that moderate wasting group. That's a very, very broad range of children, from children who've sort of slipped into becoming moderately wasted because of repeated episodes of illness, versus children who've had a long nutritional deprivation who ended up with moderate wasting. So we're trying to work out which of these children need interventions and what. And in this question, the what is about specially formulated foods versus non-specially formulated foods and what they would be. Now, PICO question number 8 seems like a repetition, but it's actually not, because it's about the overall dietary treatment for moderate wasting. And you can see this feeds into when we're talking about simplified approaches treating moderate and severe wasting together. PICO number 9 is looking at the optimum quantity and duration of IUTF for severe wasting. So it's quite a key question when we're looking at simplified approaches. Now, just a little note about this one is that none of this is as simple as I would like to have thought it would be in the beginning. So, for example, when we're looking, we have to look at studies where they're looking at, say, an adapted duration or an adapted quantity of IUTF, but compared with another study where there's also the standard IUTF given. So not comparing it to another center where there was a standard protocol, but there wasn't IUTF actually there because of an unfortunate stock out, but really comparing children who were getting an adapted dose of IUTF versus children getting a standard dose. Okay, so we can't compare apples or oranges. This may mean that we go down in the number of studies that we can look at, but we have to be really, really clear about what we're looking at so that we reduce the risk of any kind of bias and that we're really getting the most balanced view of the evidence and the most rigorous view. So then PICO 13, we're looking to the identification and treatment of wasting by community health workers. So a really, really key question for simplified approaches. And again, don't forget, don't just look at quantitative evidence, we draw in a lot of qualitative and resource use as well. So then indirect, and these I think could be really interesting as well in terms of, so post-discharge intervention, who could benefit from a post-discharge intervention and what? And then community characteristics, increasing or mitigating risk of wasting. Now you can see all of these could really, we hope, come up with helping people to make decisions about when, what, if they use simplified approaches in terms of what are the characteristics of the community and who can benefit from what. Next slide, please. So again, just re-emphasizing great approach. So it's more than just the evidence. We really try and bring in the other elements. And of course, we have the experts in the GGG who come from a very wide background, who are going to be trying there to give us a really balanced view of reading the evidence and coming up with these recommendations. Now, of course, with WHO, so this is global guidance. And of course, then this will need to be made more specific to context. And of course, as many of you will have read word for word, the WHO commitment at the Nutrition for Growth Summit that we made alongside UNICEF of really committing to help countries come up with context-specific guidance that's going to come out of the wasting guidelines to produce guidance. And we really want to help countries do it so that it's relevant to them. And then the other interesting aspect for us as WHO, as the normative agency for health, is that we always have to have this balance of the public health approach versus a patient-focused approach. Let me give an example of that. We've seen in some of the evidence which has come out about using simplified approaches that maybe children over 8 kilograms, children over 2 years, they don't benefit as much from some simplified approaches, for example, as children smaller and younger. So what does that mean for this context then? We can look at it in terms of some evidence shows that maybe the efficacy and recovery rates go down to, or could be good enough for 70% of the cases. Now, public health me says 70% is pretty good, but the doctor in me says that's 30% of kids who are not being really looked after as the best we can do. So how do we balance that? Well, really, that is ultimately going to come down to the decision makers in country to make up what are the best decisions for their country, with us as WHO and UNICEF really trying to give them all the information and all the evidence to make those decisions. But we have to keep having those difficult discussions and thought process to make sure we're coming up with what is the safest and most efficient for our children, our wasted children and their families. And then finally, as Saul was mentioning, the health system integration. This is so important. So I always think of it in terms of, is the health system ready? I remember, I'm sure many of you remember when we started to see community health workers doing a lot of screening, and this was such an amazing thing that everybody thought was so positive. And then we started to see a few little negative aspects. So community health worker would screen the child, read MUAC, turn up at a clinic, get to weight for height taken, said, no, child doesn't fit the nutrition program, sent away. A mum who's walked for a long day, half a day to get there and is told this. How does this impact her trust in the system? Her trust in the community health worker? So we need to be ready. What message are we going to give the community health workers? What message are we going to give the health facilities? If we start having lots of mums doing family MUAC, who are going to be then assessing their child to be red, going to a clinic, what if they then get the MUAC taken again and they're yellow? Are we ready for that? Are we ready to tell the health facilities how to counsel that mum? Are we ready? Actually, if we suddenly start producing a higher caseload, is the health system ready? So these are all the questions that each country, each region, each district needs to have those difficult conversations to work out what is right for them, always, as ever, using the best evidence. So we are trying to keep you updated on the process for the guidelines. And so on the childwasting.org website, there's a tab for normative guidance, and we will put everything up there as it comes to try and keep everybody as updated as possible in this process. And we're excited about it. It's difficult. We're going to have difficult discussions, but we still hope that ultimately we are going to be improving we're going to be helping our colleagues in the field with making these difficult decisions. And we really are going to be improving the lives of these children and their families. Thanks so much. Back to you, UNICEF.
Great. Thank you very much. Thank you very much, 𝘶𝗶𝗺𝗲. Lots of really important points for us to keep in mind, but also very much appreciate the update. I know there's a lot of interest in the process and how it relates to the work around the simplified approaches. So thank you very much for that. And now I will hand it over to Erin Boyd from BHA, who will lead us through a panel discussion with a couple of other donor colleagues who I'll let Erin introduce. Thank you.
Thanks so much, Grace. And thank you to 𝘁𝗵𝗺𝗲 too from WHO for walking us through some of the updates, which it's been so great to see the progress on. I'm really pleased to be here to moderate this panel. It's such an exciting time in the wasting world. And I'm very happy to have with me 𝘁𝗶𝗺𝗃𝗀𝗃, who's the Senior Program Officer from the 𝗹𝗶𝗸𝗃𝗀𝗃 Foundation, and also 𝗹𝗶𝗺𝗃𝗀𝗃, who is a nutrition expert with 𝗹𝗶𝗸𝗲. And we're just going to have a quick conversation. I would just ask that 𝘹𝗺𝗃𝗀𝗃 and 𝘁𝗶𝗺𝗃𝗀𝗃 both have their videos on. There they are. Sorry, I had the wrong view. So I just wanted to start off just to ask, I'm going to start with you, 𝘁𝗶𝗺𝗃, just if you could please give us a little bit of a reaction to what we just heard Saul and 𝘁𝗵𝗺𝗃𝗀𝗃 from UNICEF and WHO share with the overall group in relation to the simplified approaches, if you have any reactions that you want to share with the group.
Yeah, thank you, Erin. Happy to, and thanks so much for to UNICEF and WHO and everyone for making this event happen this week. Excuse me. It's a really, really exciting series of sessions this week that I'm really looking forward to. For those of you who don't know, the 𝗹𝗶𝗺𝗃𝗀𝗃 Foundation is a private foundation focused on grant making exclusively on global nutrition through research, policy, and advocacy. And from where ECF has been participating over the past 5+ years, it's really remarkable to see the immense momentum around simplified approaches. I think 5 years ago, we were in a very different situation, as Saul really outlined in his timeline of just the very beginnings of some of the initial studies coming through and people starting to gain a little bit more interest and curiosity around simplified approaches. Today, where we are right now is completely different and a really exciting place to be in as a nutrition community when it comes to thinking about helping close the coverage gap on wasting treatment. From a donor perspective, the simplified approaches make so much sense and can be a no-brainer in terms of investment. Of course, there's a lot of emerging evidence and new evidence to continue to generate over the next few years as well. But I think that it's really clear that there are gains to be made with our current system for wasting treatment through the simplified approaches in various contexts. And I think that these approaches and really thinking about applying them in real contexts at a greater scale and supporting the scale up of these approaches can really help make strides in making finite resources that we have towards wasting go even further, reach even further children, and support the scale up of this life-saving intervention. So overall, this is a conversation we're eager to be participating in and really excited for the level of interest and commitment to simplified approaches.
Thanks so much, 𝘁𝗶𝗺𝗃𝗀𝗃. I think I'm also very excited, I think from the USAID side. I didn't introduce myself, which was my fault, but just to say from the USAID in the Bureau for Humanitarian Assistance, and then more widely within USAID, we've also really taken on the simplified approaches and been asking our implementing partners, particularly in humanitarian settings, to really start to implement the simplified approaches when it's possible. And I am going to hand it over and just ask Marie-Sophie if she has anything to share from the 𝗹𝗶𝗺 perspective, specifically on what 𝗹𝗶𝗺 might be funding currently or in the recent past in relation to the implementation of various simplified approaches or research. So Marie-Sophie, over to you for any sharing in that space.
Thanks, Erin. And yeah, so I'm working with 𝗹𝗶𝗺, and I really echo what was said just before. I think it's really exciting to see, the progress we've been in the past few years and where we are now, and the breach of having normative guidance coming up, and to see that, yeah, all these very difficult questions are going to be And so at least, we're going to have some choices and country decisions to be made. I think from 𝗶𝗁 point of view, we've been supporting a lot of the big pilots that were mentioned before, the Mango, the Optima, and not so much 𝘁𝗶𝗺𝗲𝗀, but we were really looking at the progress of that. Today, we don't really have funds dedicated to the research themselves, but we try really to encourage our partners when it makes sense to consider these approaches. So I think in the region where I work here, we cover a lot of course, we are promoting a lot of the family MUAC, especially in the context of COVID. But also the approaches of combined protocol where you can have MAM and SAM treated on the same product, or looking at the reduction of the dosage of product as well, when we know that the pipeline are going to be a little bit short. So I think there is not really one approach. I think, as it was said at the beginning, it's a set of variation that could really help overcome bottlenecks. And I think where we work in all these areas where we have difficulties in terms of access, in terms of capacity, in terms of pipeline, it makes sense to really encourage our partners to see how they can best deliver to optimize our impact. I think it's eventually, I think in humanitarian setting, it's eventually about reaching the most children and optimizing the resources we have to ensure that they will get treatment. Thanks.
Thank you. And I can also share, I'm adding myself into the panel a little bit, from the USAID perspective. As I mentioned, we have been asking partners to implement simplified approaches, particularly family MUAC, and I think that's one, we're focusing on because it is something that really allows for that increased scale, and also just the awareness raising aspect of it, drawing more attention to wasting in communities, which we see a lot of value in. We also have seen a lot in specific countries on using community health workers, particularly in West Africa, to treat wasting. And I think there are, in humanitarian settings, some opportunities and challenges with that, which we'll get into. I would add, from the USAID perspective, we did fund, and we have some ongoing research, but we are really interested in better understanding the progression of wasting and how some of these simplified approaches can influence that progression. So for example, we have a study right now that ACF is implementing in 3 countries. It's looking at relapse. And we also have a study that's ongoing in relation, looking at some of the wash and wasting, those linkages, and trying to see how the simplified approaches can also maybe help with that full package, right? To ensure that children recover as fully as possible and stay recovered. So I think some of those pieces are certainly of interest to us. I'm going to turn back to Chaitanya and just ask a question about research in terms of how it's influenced Eleanor Crook, and I think, and how ECF has been influenced by the research. I think that ECF has been such a leader in bringing forth more attention and spotlight to wasting, but I'm just wondering, even from that perspective, if there's one particular aspect of research or one particular example of implementation that's really spoken to you, Chaitanya, as you've kind of started in this wasting work.
Yeah, thanks for the question, Erin. And yeah, that's exactly right. At ECF, we kind of straddle a few different modes and spheres within the global nutrition space, both on the research side and also some of our advocacy work to elevate the issue of nutrition and wasting specifically. I think where the current phase of research is for a variety, and the majority of the simplified approaches really falls within implementation research, and really some of these how-to questions. Now that we have some of these specific tweaks and innovations identified, how do they actually work in real-time operational settings, and how do you support the adaptation and constant assessment of some of these tweaks that we're seeing? And I think that That's a really important question that we have a lot more to unpack further, and ECF and partners are also trying to support with our current research portfolio in terms of helping answer some of those questions even more. And I think that when it comes to kind of where we are in the progression of the evidence kind of pipeline and the initial really compelling kind of smaller scale pilot studies that have been so foundational to this whole momentum of and conversation and movement around simplified approaches, that's been really, really great. And I think that moving forward, I think the questions that we're trying to focus on with our research investments, and I think are really important when thinking about country adoption of these approaches, is some new evidence generation around how to scale these approaches in appropriate contexts. Really thinking about beyond the pilot scale type of project, and really thinking about some of the broader questions around simplified approaches. I think in my mind, some of the costing work when it comes to various adaptations or improved approaches is really important, and building off of what we already know to really help answer what are some of the additional costs that need to be considered, but also the potential cost savings. I think when thinking about a combined protocol for MAM and CM treatment and potential cost savings of reaching children sooner with and earlier before the progression of that severe case of wasting is really important and could potentially be extremely compelling for governments. I think also when thinking about a slightly broader geographic scale of implementation, some of the bigger public health questions around kind of impacts on caseload, how these different interventions work in slightly different contexts with varying ranges of health systems, infrastructure, capacity of different cadres of community health workers, and that type of contextual evidence is going to continue to be really important moving forward as governments are considering if and when to adopt these approaches.
Right, I think that, thank you. And I think context comes up so often. And I would just say that I know from 𝗹𝗶𝗸𝗲, who's worked a lot going back to the olden days of CTC maybe. And we all, you know, those of us who have been around a lot of different sort of adaptations that have just been necessary in crises in particular, I think it would be interesting to hear your view on this piece, but also 𝗹𝗶𝗸𝗲, I really would like to know your perspective, since you've been involved in this work for so long, on what we don't know too. So if there's anything specific about research that really excites you, but also on that what we don't know, it would be great to get your thoughts on that.
Thank you. Yeah, no, I think that now, indeed, I think it was really well mentioned, the fact that we are looking, of course, at the efficiency, at the you know, how we can actually deliver that kind of treatment, and of course making sure that it's up to the standards. But what we see is when we are talking now in terms of scale up is what does that mean? And I think it's really for us the next question, if it works, great, but what in terms of resources, in terms of capacity, do we really have the shoulders to take that over? And I think we are, you know, asking a lot of questions. It might be a little bit early. We have to be certainly very patient, because now we are just looking at the what work part, but we need also to be very realistic on what it will mean in terms of implementation, in terms of the training, etc. I think certainly the question that would be the most, I mean, have meet the most difficulty, at least in the countries where I work at the moment, is really that one, because I think now we have a lot of the countries that are ready to see some shifts in the way they do nutrition. I think, for instance, in Ethiopia, we had a big breakthrough with the you know, green light to use the simplified approaches, but then it was almost you know, followed up by a wait a minute, because what are we going to do? Or do we know that we can actually scale up this type of approach? And it's a very good question indeed, because we don't want to create another type of problem. So I think the one of the resources, the capacities are really certainly the next one to follow very shortly, the recommendation that will be issued by WHO. I think that, I mean, the questions that were already covered by our colleague from WHO are really extensive already. So I think it's very good to look not only at the treatment itself, but indeed at the post-treatment, at the moderate wasting, etc. These are pretty pretty expensive. I think when we have some ideas of all this area, certainly it will be. We will have made a big step forward. So yeah, the one I can think of right now is really that one. And I think just thinking how long it took also for us to reach that point. I think, you know, it take a lot of time to train a full health system into a protocol, and we have certainly to also manage our expectation on how fast we'll be able to roll out future adaptations in the coming years. And so I think it's very important that also we coordinate very well, and we support all of us this rollout in an efficient manner. Thanks.
Thank you so much. And I think I would add to that, I think the scale, the efficiencies, and then I also feel this big space, since you mentioned Ethiopia, you know, when it comes to maternal nutrition and maternal wasting in particular, I think with the simplified approaches, there might be also an opportunity to look at that. It's included, but, you know, how do we ensure that that piece is as well as addressed as possible? It's a little bit beyond the scope, but I think it's a really important area, that linkage. I also think with that example in Ethiopia where, you know, it is such a long process, even in an emergency setting. And that was one of my kind of final questions, just what do implementers need to think about? And I think at least at USAID, we do ask our implementing partners, many of you who are online right now, to ensure that they're in line, whatever they're proposing to implement is in line with the nutrition cluster or sector and with the Ministry of Health. So I think a lot of this socialization, sensitization, evidence, and the work that's going on with ministries is really the key, you know, as early as possible to make sure that implementers have that in mind, so that coordination happens, and a lot of that information exchange and sharing, so that we make sure that ministries are able to adapt their guidelines moving forward. And I think, you know, a lot of that plan is in place, and some of it is happening, and just sort of accelerating that process is what I'm looking forward to. I am just going to ask, I'm going to close the panel and just say that we do have some additional time. Some people have raised a couple good questions about combined protocols in particular when it comes to RUTF, and also thinking about low literacy health workers. And so some of that is going to be addressed over the course of the next 3.5 days. So I'm not going to speak to them now, but I would just like to ask 𝗺𝗻 and 𝗺𝗶𝗺 if they have any final thoughts before we close the panel, and I hand it back to Grace. So maybe I'll start with you, 𝗺𝗺.
Yeah, just maybe one quick final point, building off of what you just said, Erin, and really thinking about supporting the uptake and implementation, building off of 𝗁𝗄𝗆's really helpful walkthrough of the WHO guideline review process, which I know so many of us have been really waiting for years. So it's so exciting that WHO is doing an amazing job, really doing a rigorous review with this update. And one of the things I'm most looking forward to is, in addition to kind of the official normative guideline, to really think about the suite of implementation guidance derivatives that will also be coming out as kind of the next step from that review process to really support country level uptake and implementation tools on simplified approaches or wasting treatment more broadly. So really looking forward to that.
Thank you. And Marie-Sophie?
So on my end, just maybe to mention the integration bit, because I think that we see that you know, indeed the rollout is going to, I mean, the tools, the way it's going to be rolled out is really important, but I think also we see well, we can still do a lot better in terms of making sure that there is a comprehensive care provided to these kids. Not only, you know, looking at the nutrition and at the health. I think, you know, for us it's obvious, it's clear, but yeah, there is still a lot to be done. And I think this simplified protocol, simplified approaches are going to really facilitate that process, because for now it's such a bulky protocol that we are using, and we understand that in a, you know, in all contexts, it's not always easy to do. But yeah, I think we also have to keep in mind this, you know, going back very closer to primary health care, and as you said, looking with the maternal nutrition, looking with the young children as well. So yeah, I think it's the whole package at once. Thank you very much.
I couldn't agree more, and I thank you both so much for taking the time this morning, this evening, and I hand it back to you, Grace, so that we can continue on. Thanks so much.
Thank you.
Great. Thank you, Erin, Chaitanya, and Marie-Sophie. That was very interesting. I will be handing it over to my colleague, Sophie Woodhead, who will share some resources and tools, and along with giving us an overview of what is happening where, including two of our regional colleagues. I do also want to remind everyone to please include any questions you have in the Q&A. And we will also have time at the end of the session for some live questions as well. Hopefully, I know we're giving you a lot of information today. I noticed that a lot of the questions we may answer over the course of the week, but we'll try to get to some of them at the end of the session. So Sophie, over to you.
Brilliant. Thank you so much, Grace. Hello, everybody. My name is Sophie Woodhead, and I'm working with the UNICEF nutrition team in headquarters. And I'm going to take you through, as Grace mentioned, some of the tools and resources, but just coming back a bit to our objectives for this learning event, but also for the Global Working Group on Simplified Approaches. What we're really trying to do is to support the implementation of simplified approaches where they're implemented, from conceptualization all the way through to monitoring and evaluation. And the reason being is that we really want to ensure that quality services are implemented and those good nutrition outcomes are achieved. And we have an ever-growing number of experiences in both research and operational contexts, which have provided key learnings. And as Grace mentioned, we'll take a look at those shortly. But first of all, we wanted to share with you some of the tools that we've worked on collaboratively with the Global Working Group. Slide, please, Milash. So firstly, what we've developed is a series of introductory documents designed for technical and non-technical audiences, really with the purpose of informing and sensitizing. Over the past few years, there's been a lot of calls to standardize definition and language around the simplified approaches, which is what these series of documents and videos seeks to do. So as you saw at the beginning of the presentation, we have an introductory video which serves to give a bit of a background justification and also help to define what the most common approaches are under the umbrella term of the simplified approaches. Those videos are also available in French and Spanish and can be shared too. We also have at the bottom left-hand side, you'll see a series of documents. So those documents summarize a lot of the justification that we've heard from Saul in the donor panel just now as to the importance of simplified approaches. We have frequent FAQ, frequently asked question, which helps to bring together a lot of the questions that have come up over the past 18 months when practitioners have been implementing the simplified approaches, either through technical webinars such as this one, but previous ones in the kind of COVID-19 context, and also there's a document focused on informing national ministries on the technical global guidelines update process, which is part of this of all of the simplified approaches. On the right-hand side, you'll also see a dashboard, a visualization, and I'll come back to this shortly, but what this helps to do is demonstrate where the simplified approaches are being implemented. Learning from essential, and building on this learning will help us to continue to build stronger interventions. And so this dashboard really aims to demonstrate what is happening where and to facilitate that sharing of information. Next slide, please. So on this, on the next slide that will be coming, yes, thank you. We can see that there are also another group of tools that we've developed. On the left-hand side, quick guidance. So these really synthesize evidence into 2 pages on specific simplifications. So what will the objective here really is to, in kind of non-technical or non-research language, to synthesize down the evidence and the current thinking on the specific simplifications that we've heard before. The objective here is really to support the decision-making process and the design of interventions using simplified approaches. It really, these documents serve to bring together everything that we know and do that in a very concise way, or as concise way as possible. On the right-hand side, we have developed with the Global Working Group a series of planning tools. So these are step-by-step tools on what is needed for the implementation. They're a very practical set of tools, as you might be able to see. We have a checklist for implementation, which is really to support all of the different steps to be taken as you go through the setup of a simplified approaches intervention project program research. We also have concept notes, templates for those, as well as templates for implementation plans, which are really essential as we're working to, as we know, simplified approaches are changes in practice, and so therefore implementation plans are really a key part of the process. We also have we've compiled all of the protocols that have been trialed to date into one document, so that can be easily accessible, as well as developing a caseload and supplies calculator. And we're going to be going into that more in depth in the session on Thursday, when we're looking at the combined nutrition protocol. And finally, there's also work plans and budget templates, really, as you said, to support in the planning process. Next slide, please. So this also shows that something that's available on the Simplified Approaches website, which is a consolidation of all of the reports, studies, and tools related to simplified approaches. So as you can see, there's over 90 documents, 90 unique documents, ranging from research protocols to lessons learned reviews. And what you can do is you can filter all of these documents either by the simplification. So if you're specifically interested in looking, for example, at the treatment of wasting by community health workers, you can pull out all of the documents that are linked to that specific simplification. You can also filter by country, which is really important. If we're thinking of implementing any simplified approaches, then this resource is a great place to start in order to be able to find and identify all of those resources or any activities that have happened at country level. Next slide, please. And then moving from the tools to looking at implementation. So what this visualization is showing is the countries that are engaged in simplification. So we can see 52 countries are reporting some kind of level of implementation of a simplification or perhaps multiple simplifications. As Saul mentioned earlier in the presentation, I think he said that around 70 countries are implementing CMAM, and we can see that 52 are to some point engaged in simplified approaches. That really, I think, goes to show that there is already a lot of uptake or engagement in the simplified approaches. And as we also mentioned earlier in the presentation, COVID-19 was a big driver of that. Many simplifications were taken up in that context, particularly family MUAC. That simplification is currently being implemented in 39 different countries. So it's by far the most popular, so to speak, simplification, and one that was, of course, extremely relevant and continues to be in the current context. We also see 31 countries are engaged to some extent or another in the combined protocol. So that's either using a 𝗺𝗶 and 𝗺𝗶𝗺𝗲 only admission criteria, that could be using one product, or that could be the expansion of 𝗺𝗶 cutoff. So there are quite a few countries already engaged in that bucket of simplifications, followed by reduced frequency, so visiting the health facility fewer times over the course of treatment, and then 22 countries engaged in the treatment of wasting by community health workers. So I hope that this kind of goes to show that there is a lot of engagement already. This isn't representative at national level. This is just countries reporting some level of implementation, but still, I think that it's a very clear indication that there's high levels of uptake of the simplified approaches. So I'm going to pass on now to our regional offices. And I believe we've got the East and Southern Africa Regional Office first. So over to you, Michelle. Slide, please.
Okay, thank you, Sophie. And my name is 𝗁𝗁𝗲𝗃, and I am a consultant with the UNICEF East and Southern Africa Regional Office. And I've been working on conducting a landscape analysis for simplified approaches, and then also working on some capacity building initiatives within the region in relation to simplified approaches. So today I'm going to present some of the things that we've done. So, looking at this slide and kind of reviewing, we conducted this landscape analysis in a total of 13 countries. So it wasn't in every single country in the region. In a total of 48 projects or pilots with simplified approaches are implemented in the region. And you can see down in the bottom left-hand corner the number of each approach implemented in different countries. So by far the most popular is family 𝗺𝗺, and then this is followed by modified dosage of RUTF and 𝗺𝗺 only admissions. And then we looked a little bit further into the reasons that country offices implemented these approaches. And so prior to COVID, we actually had 29% and 27% of countries were already implementing simplifications. And so some of this was as a pilot to just kind of generate evidence, or it was in an emergency context to mitigate kind of operational challenges. So prior to COVID, we already had kind of 56% of the countries were implementing a simplified approach in some way. And then with the onset of COVID, we had an additional 33% of countries initiate a new simplification. And then 13% of the simplifications were for, activated from COVID or scaled up from prior, simplifications that had been implemented first. So really with the onset of the COVID-19 pandemic, there was a 46% increase in simplifications in the region. Next slide. And so what we wanted to do was really look at the scaling up, potential of these simplifications, with the ongoing, COVID-19 pandemic, and then, beyond COVID, what is the potential in the region? Which direction is the regional country offices going for this? And so if you look at the graph on the bottom right-hand corner, you can see that the blue means yes, countries are interested in scaling up these approaches even beyond the context of COVID. And then the orange means that they're still in the pilot phase and generating evidence for this, so it's unclear whether or not they will kind of be scaled up. And then the gray is that there's not a lot of interest in scaling up these approaches at the moment. And so if you look at the graph, family 𝗺𝗺 has the most traction, I think, as we've seen in a lot of places. And then it's really followed by CHW treatment, which is kind of split in two. So 50% of countries do have an interest in scaling this up, and another 50% of countries implementing this approach are still piloting and doing some operational research to kind of really integrate this approach into the health system and determine the best modality of doing that. And then if we look at the approaches that there's not that much traction in the region to scale up, we have expanded admission criteria and also reduced frequency of visits. And so, coming from this landscape analysis, the region, got together and kind of looked at the main priorities. And so the first priority is to really define the simplifications that are ready to scale up. How do we move from the pilot or the emergency context to a health system implementation, and kind of, what are the thresholds for that transition? Additionally, there were a number of gaps identified during the landscape analysis. And so strengthening those gaps is a major priority in the region. And I just put 3 of the main gaps in here. The first one is data collection and documentation, and this is especially within the context of the existing health system. The second is supply pipeline support, including caseload calculations and costing scenarios. It's a big gap we've seen in a lot of the country offices. And then supporting training and capacity development initiatives for simplifications in the region. And then lastly, the landscape analysis illuminated a lot of research questions that we still need answers to. So continued implementation of this research. And then in the East and Southern Africa, we also have a technical working group, and there's kind of 3 priority areas of focus, and it's in relation to, kind of the direction of the regions. And so really it's continued evidence building, especially with operational research and within the health system. And then looking at technical support and capacity building, and also context-specific guidance with simplified approaches. And what that means is, like, one of the things we're looking at is kind of scale-up readiness assessments and that kind of thing. And so that's the perspective from the East and Southern Africa region. Thank you, and over.
Great, thank you. Over to you, Justine.
Thank you, Sophie. So hi, everyone. I'm Justine here. I'm working as a nutrition specialist in the Western Central African Regional Office, mainly on the wasting agenda. So I'm going to present, next slide. Yeah, I'm going to present the overall overview of where we are at in the region with simplified approaches and how we envision to move to scale. So out of 23 countries, we have 16 countries that are implementing at least one simplified approaches. As in SRO, the most popular simplified approaches is 𝗹𝗶𝗸𝗲𝗆. And we have more than 730,000 caregivers that have been trained. So far, the highest numbers is in Nigeria, followed by Mauritania that has started implementing 𝗹𝗶𝗸𝗆 in 2017, while other countries started as consequences of COVID. So as it was said earlier, COVID was a good momentum for simplified approaches also in our region, notably on combined protocol and community health treatments. So we have now 3,400 community health workers that are trained with highest numbers in Ivory Coast and Mali. And it should be noted also that in Mali and Togo, this approach has started earlier than the COVID, but for other countries, again, the COVID was a good momentum to push forward this approaching. And there is also an increasing number of countries that are implementing combined protocols, mainly as pilots through research. So earlier in the presentation, we spoke about the 𝗶𝗶 research or the 𝗹𝗶𝗸𝗲. So they have been implemented also in our region. And we should notice that Burkina and Mali are actually implementing the 3 approaches gathered under the combined protocol. The admission based only on MUAC, the one product, and the modified dosage. And this was due to the COVID, but also to the very high insecurity in those areas that obliged them to go to those simplified approaches. So as you see, we have lots of pilots and also evidence that a great number of simplification and adaptation have successful results. But unfortunately, all these projects are still pilots. And we only have 3 countries that have simplification as part of their protocol: Burkina Faso, Sierra Leone, and Nigeria. Next slide, please. So what we want to do is to now try to move to scale. And for this, we had a first session with all the countries of our region in October to define priority countries and packages of simplification that are context specific. So we have a reflection on what dimension and type of scale we want. So first, geographical scale with in the region, expanding the number of countries in the region that are implementing simplified approaches, and at the country level, of course, expanding the region in the country that are implementing those simplified approaches. And this should be combined with, of course, vertical scale. That is to say, integrate simplified approaches in the program design and also the strategies at the national level. And finally, with functional also scale up, which is okay, starting with one approaches and then go further and further, and also link those simplified approaches with the prevention, because we really want to link the dot with prevention, ensuring that we have an integrated package that includes both prevention and treatment with simplified approaches. So we, in each country, we try to define minimum packages of simplification linked with the level of readiness of country, the enabling environment which already exists, policies, partners, financing, how ministries are ready or not to implement those simplified approaches. So this is a bit the approach that we are now trying to put in place. So it's the first step, and now we will have technical support of this country. We plan also in 2022 to do virtual coffees on simplified approaches with the country and have bilateral consultation to build on that first, I don't know how to say that, first exchange with the countries. And the idea is then to have really a roadmap and to mobilize partner and funding around the scaling up of these simplified approaches. And we will also take the opportunity of a communication campaign. Then we will launch next year, the Nutrition Now campaign, to also speak about around the simplified approaches and mobilize funding. So as a concluding word, we would really like to convey the message that in our region, we have rich ceiling regarding the coverage of the treatment of acute malnutrition, and we must decentralize to communities to have a better coverage, but decentralization cannot happen without simplification. So we will do our best to move forward and help country on that. Thank you.
Thank you, Justine, and thank you, Michelle and Sophie, for sharing the resources, but also the experiences from your regions. I know there is a lot of question and interest on tools, but also how does this look at scale, given, I mean, they're called simplified approaches, but it's quite a complex in terms of when we're talking about scale, what does that mean? Also related to what was shared earlier by WHO, knowing that some of this is still under guidance review. So what I would like to do now is introduce my colleague 𝗹𝗶𝗺𝗲𝗆, who will moderate a panel discussion for everyone who has presented. I would ask if you could please turn your cameras back on. And for those of you who are on the line, if you have questions, please do pop them in the chat box, and we'll try to get to as many as we can with the time we have left. 𝗹, over to you.
Thank you, Grace. Thank you. And thank you so much to all the panelists who joined us today and to open this week of learning on the simplified approaches. So as Grace mentioned, I'm a nutrition specialist working at UNICEF headquarters. So good morning, good afternoon, everyone. I hope the sessions were interesting to all of you. And yeah, I already saw some questions coming in the Q&A box. Please keep sending more. We are going to have around 15 minutes to discuss. So yeah, feel free to add more. Just to repeat as well that we're going to focus on questions related to the implementation of the simplified approach, on the how, and that's really the focus of the learning events. And also to remind everyone that we have more sessions to come in this week. So maybe to start, I'm going to be the first one to ask the questions, maybe. And can I direct some first to our regional colleagues, maybe. So Justine and Michelle, or whoever wants to jump in. But maybe can I start by asking, do you have any advice maybe on how the countries can engage with our counterparts at government and ministry level for the introduction or the implementation of the simplified approaches? And maybe if you have any examples from your regions that you could share. I saw some questions related to that as well, the engagement from the governments. Michelle or Justine, if the first who feel inspired. You're on mute, both of you. Michelle, you're on mute.
Sorry. Yeah, thank you for this question. I hope it's okay if I just kind of start, just kind of based on the interviews I've had with the country offices here. It's actually one of the kind of key factors of success was coordinating with health ministry colleagues, and specifically going through, national nutrition coordinating bodies from the get-go, from the initial start of the implementation or initiation of the simplifications. And, the countries reported that it really does kind of, allow for discussion and agreement upon any issues that can come up, and then kind of a unified and coherent approach to like the pilot methodologies, to guidance notes, to SOPs, to any kind of tool development and that kind of thing. And it really was again and again one of the key factors of success. And then specifically one of the countries I spoke with, they really involved their master trainers in the development of a pilot methodology and all the tools for that. And so that kind of created, a really strong capacity already in country at training level. And so when it was time to really kind of cascade the training down to the different levels, they had quite solid capacity in country who, the master trainers really knew the new simplified, protocols and guidance notes and all the tools. So that was I thought a really creative and good way of, kind of making sure that there was capacity for training and capacity development already in country from the get-go, as opposed to having to do separate trainings on simplifications for master trainers. So I thought that was kind of an interesting thing. Now I'll go over to see if West Africa has anything to add.
Thank you, Michelle. Great.
Thank you, Michelle. For our part, this is indeed a question that is often asked by countries, because they say, okay, we are now at pilots, so how do we put this to the ministry? And they also in their technical support they also want us to help them try develop advocacy notes to go to the ministries and advocate for those simplified approaches. That's after the first meeting we have with them, we've done a little questionnaire on what type of technical support they would like, and this was actually the first one. So yeah, I don't really have much to say about that, because this is the step that we are now trying to move forward.
Great, thank you. Thanks for your answer, Justine. Thanks to both of you. Okay, so before I pick more questions on the Q&A, maybe I'll add another one from me. So questions to the donor panelists, so Erin, Chaitanya, and Sophie. In your opinion, or based on your experience, do you have in mind an example of a successful implementation of the simplified approaches that you may have seen, and that I know you've actually mentioned some already, but maybe one in particular that you would like to mention? Sam, the first who feel inspired. Erin.
Sure, I can start. I think for me, again, I've seen it more so in emergency settings. So going back to before simplified approaches were called simplified approaches, and going back, I think even to like 2010, there's a couple successful examples from Myanmar and also from Pakistan. In Pakistan in particular, what I would like to flag is that, it was a situation where there were no MAM treatment facilities at all in some of the flood affected areas. And what I really like about that particular example is that it was using, RETF to treat MAM, and it was also using the lady health workers in Pakistan, expanding that network to do more intensive active case finding. It wasn't family MUAC, but like a sort of a very early iteration. And I think what was interesting was that there was a memorandum of understanding that was signed between WFP, UNICEF, and WHO, as well as the Federal Ministry of Health. And I just highlight that because I think it was a really successful and light approach to temporarily address wasting on the continuum in a really urgent and important way. Another example from more recent times, I would say, has been in Afghanistan. I think 2 years ago, where because of some pipeline constraints, there was a change in dosage actually of 𝗺TF, which was successful. And again, highlighting that one, you know, USAID was supporting implementing partners, NGOs, and also part of the 𝗺TF pipeline via UNICEF. So there was a lot of communication about how to document that was not an inferior approach, and changing the dosage of 𝗺TF for wasted children would result in the same types of positive outcomes. And then finally, I would just say that, you know, of course, with COVID, we've seen a huge, it's already been mentioned, but for USAID, we've seen our partners basically everywhere doing family MUAC. So that's been really important in Yemen, for example, as well as, you know, has already been mentioned by Justine, but like in Mali and Burkina Faso, we've seen that really across the board to help continue treatment, I would say. And I would also really flag some of the work that Action Against Hunger has piloted, and now is kind of being more institutionalized on using community health workers, for example, in Senegal, Niger, to treat wasting. Sorry, that was a lot of examples.
That was great. That was great.
Taking time.
Thanks, Erin. That was great. I really liked it. The fact that, as you said, it's not just staying on the standard protocols, but going beyond that and just really focusing on the need of the children, as you gave the example of Afghanistan or the combined protocols. Just leaving some time in case Chaitanya or Sophie, you want to come in. Sophie.
I step in, yeah. So yeah, no, I think it's hard to pick, because indeed, when it works well, it's and indeed, I think the reduced dosage. I think the ICF also in Bangladesh, they tried that, coming from an operational constraint, how to really define a protocol that would inform also for future situations like that, how to maintain a good quality of performance and of care for the children. So that was very remarkable. I think Family MUAC is certainly the winner of the year. Also the fact that it's been such an obvious one, and certainly that fueled a lot of the success. I think nobody really questioned at the time of COVID the fact that yes, we needed to do something to keep on identifying children and treating them. So it was certainly a very, very timely era for that scale up. And I think it shows also when the need is obvious and when everybody sees the benefits of that, I think we can really see all together how to overcome the difficulties, because I think that not all the countries were really convinced by the time, before COVID, and it became something that was a no-brainer. So let's try also to create that appetite for change, and to really see what the potential are for the other adaptations to see such maybe a scale up and an appetite later.
Great. Thank you so much, Sophie. Okay. So maybe I'm going to pick some questions from the Q&A. So back to what you were saying, Erin, actually, I saw some questions indeed around moving to 𝗺TF for the use of 𝗺TF for all wasting, or some questions around the use of common products. So I see two in the Q&A. Maybe can I ask you, Grace? Would you come in for this one?
Sure, I'll take the easy question. I think this is a question that I think we get a lot, and is very understandable, given that when we are talking about the modified or simplified dosage, it usually does include the one product. Under current WHO guidance, RUSF is not used for treatment of severe wasting. So we will continue to use only 𝗺TF for the treatment of severe wasting, and in some cases where we are looking at both severe and moderate wasting together in the same protocol, we're using 𝗺TF. We are also currently, UNICEF is looking at different formulations for our UTF, but right now the only product that is referred to when we're talking about use of a single product for the treatment of wasting, we are speaking of our UTF.
Thank you. Thanks, Grace. Still in the Q&A box, let me take, there's a few questions on 𝘁𝗶𝗺𝗲 treatment. I know that there's going to be a session later this week focusing on this one, but there's so many that I'm still going to ask some now. So there's one related, so two actually related to the simplified approaches. Is there any criteria for the literacy level of the 𝘁𝗶𝗺𝗲? There's also a question related to the existence of the simplified training package for 𝘁𝗶𝗺𝗲 to be able to use for case detection, treatment, and reporting. And some others that disappeared. But should I ask, I don't know, Grace, you just, either Grace or Sophie, or maybe one of the regions?
Yeah, I'm happy to answer the question on the resources that are available. Like you said, we're going to be having a session on Wednesday to hear more about this approach. Currently, there are a number of resources available in terms of training. There was one developed specifically for implementation in the context of COVID that really looks at treatment by community health workers. We're working on a more comprehensive toolkit that is not going to be ready until next year, but there are a lot of tools available. 𝗺cie and couple of partners do have simplified toolkit that is used in this approach that are also available. In terms of if there's a criteria for literacy among community health workers, I think that really depends on the context, and the work that I just mentioned from 𝗺cie has developed tools where there is a low literacy of community health workers. I do think that's not a very straightforward answer that it's a yes or no criteria. I think it really depends on the context. But I will turn it over to see if our regional colleagues have anything to sort of expand on that or more specifics on that.
Yeah, I can just jump in. I'm not an expert on 𝘁𝗶𝗺 treatment, but kind of in relation to what Grace said, I think some of the things that came out of kind of the research we've been doing in the East and Southern Africa region is that, you know, with 𝘁𝗶𝗺 treatment, it works really well combined with other simplifications as well. And so in addition to kind of the low literacy tools and the simplified tools that are being developed, and I think have a lot of potential, you know, really looking at, you know, 𝘁𝗶𝗺 treatment is a package of multiple simplifications just to kind of help facilitate and streamline the treatment to make it a bit less complicated and easier to implement at community level. And if there's, you know, low literacy and, you know, kind of limited understanding of kind of medical, you know, treatment of nutrition. So I just wanted to jump in and say that. Thank you.
Thank you both. So still going to the Q&A. Okay, I'm going to ask the questions, and whoever wants to jump on this one, because I think that's really an interesting one. But are any countries or regions seeing good caseload and costing estimates for scale-up, particularly for the combined protocol and all the new cases family work might identify, and who do you think would be best placed to do this? Economists, academics, governments, or UNICEF? I think we could have many different point of views on response to this one. I don't know if one in particular, like someone in particular wants to come in, or if it's too specific for now. I don't see any mic. I'm jumping to the next question.
I think that there's a lot of, like you said, different answers to that question. I think there's a lot of questions within that one question. I think, again, it really depends on the context when we're looking at and what we mean by a good caseload, and the question of the costing. I know that there's different initiatives happening around that, especially when we are looking to move some of this out of a pilot approach. But can I give you a clear answer of how that looks now and where that's available? I don't think so, unless there's anyone else on the panel that something comes to mind. But it is something we do want to consider, especially, the costing and caseload.
Thanks, Grace. Yes, Erin.
I would just add to, in response to Kate's, I think, really important question, I do think this need to harmonize costing analyses across different approaches is important. And I think that that's something that shouldn't just be academia, and it shouldn't just be governments or UNICEF. I do feel that health economists have a role to play, maybe a stronger role to play, to be brought into this conversation, because it is, even though the context is very much, you know, how functional the health system is and what's already funded, what are the recurrent costs, putting all of that into a model is really important to understand the overall way to fund things. But I think one of the challenges we have is that from a lot of the pilots on the simplified approaches, the cost analyses are different and we're not comparing apples to apples. And so I think when we're talking about scale, there is an important, you know, note just to harmonize some of the costing pieces.
Thanks. Thank you, Erin. The time is flying, so maybe I'm just going to ask the one last questions before handing over for the closing remarks. And actually to you, Grace, but with everything that we've heard today and all these sessions, can I maybe ask you if there was one thing you would like to say to implementers on the simplified approaches, what would it be?
Yeah, I think one thing to keep in mind is that a lot of this is very context specific. The simplified approaches are not the magic bullet. They're not a one size fit all, especially when you're thinking about going beyond pilots. You know, we can talk about taking family MUAC to scale, but the combined protocol is a different adaptation. It includes a lot of complexities around it, especially the points that were made by WHO. So while they're called the simplified approaches, I think at the end of the day, they are meant to simplify treatment, but it's very complex now in terms of what that really looks like on the ground. I think just remembering that it's very context specific, it is very important to bring in the ministry as soon as possible and include all stakeholders that would need to be included in those conversations.
Thank you. Thanks so much. And thanks to all the panelists. Thanks for all your questions. Sorry, we didn't have the time to go through all of them. But back to you, Grace.
Yeah, thank you, panelists, and thank you, Tram, for moderating. I know that we are at time. I wanted to just quickly remind everyone that over the course of the week, we will have a lot more time to go into a lot of the details as to how does this look like on the ground operationally. I know there are a lot of questions. So over the next few days, we will be jumping into some of these details. We will have a specific session tomorrow around family MUAC, which will be facilitated by Action Against Hunger with support from our colleagues at WFP. We will hear some really interesting country experiences. On Wednesday, we will have a session facilitated by Save the Children, where we will dive into some of the community health worker treatment. That approach, and I know there was a lot of questions around that, and we'll hear some really good details on country experiences, and a lot of the country experiences won't just be this is what happened, but there will be really deep dives into some of the tools or resources that were used. And last, on Thursday, we'll be covering the combined protocol, the combined nutrition protocol, which will be facilitated by our colleagues at IRC with support from IMC. They will also do some country examples, but really looking at some of the implementation tools. We'll also be sharing a caseload calculator as well during that session. So please join us every day this week. We will try to keep to time at 1.5 hours. And we really appreciate everyone joining and participating today. We got a lot of great questions. A reminder that after this, all the sessions and recordings will be available in French, English, and Spanish, and all the resources that Sophie shared are already available on simplifiedapproaches.org. And we will also aim to have those documents translated and the whole website's translated in the next couple of weeks. So thank you all for your engagement and participation today. Thanks to all the donors, and we will see you all tomorrow. Bye.
Bye-bye, thank you.